In a country like Nigeria, with healthcare in the state that it's in, you have to anticipate trauma. Domestic violence, Christian persecution, and poverty are just a few things that contribute to its mental health epidemic. But what about the kind of trauma that's hard to spot? The kind that a failing healthcare system brings on its healthcare workers. Like when you know ahead of time that you can't help the people you're supposed to, and even if you try, that your equipment will fail or malfunction, and on top of this, you won't have the financial resources to care for your family because you haven't been paid in months. It's demoralizing.
Poverty is the biggest problem.
Some doctors don't have health insurance.
It's been challenging as a medical doctor in this country.
We're doctors today. You can be the patient tomorrow. You can be on a journey. You can have an accident. Nobody knows who you are. And then the closest place you can go to is a primary healthcare facility where they have nothing.
It is expected that each primary healthcare should have at least mental health staff. But they are not there. They are not there. That was the aim of our primary healthcare. Primary healthcare is not a complete healthcare until that component of mental healthcare is integrated in it. But most of our primary healthcare units, you don't see mental health facility or the healthcare staff. So you can see we are not there yet.
So this health sector affects everyone.
So our agenda during the 2022 visit was to listen and understand how Nigerians view mental health. And to help start this conversation and some training, led by TJI board member Dr. Patient Lee, a licensed counselor, and Togor Gado, a master's in social work student. This is one area where our work is cut out for us.
So here are some common traumas leading to PTSD that we know is rape, sexual abuse, physical abuse, domestic violence is a big one. Combat, which we just talked about, accidents, crime, assault, whether on you or on somebody else.
We're all related to power and control.
I am excited because this is such a great opportunity for me to spend time with physicians who are passionate about the work that they do and share a little bit about some of the challenges we experience in our culture of domestic violence.
Jesus Christ explains this parable.
As a board member of Jonah Inheritance, when this whole thing was coming together, it was just really encouraging. When Dr. Gado said, Auntie, you gotta come, I said, oh, okay. I just counted a privilege to be able to, as a Nigerian, to be able to give back in a small way and just reconnect with the great work people are doing at home. They're doing the hard work with very limited, in a lot of ways, infrastructure, and are still there grinding.
I'm just thinking, I think it has to do with sometimes.
I'm very, very grateful for this opportunity. I've learned a lot.
I learned so much from the lecture this afternoon on domestic violence.
For me, my take home is that as a family physician, I can be a safe place, and confidentiality is key.
I also learned about women empowerment and education, which will help them to make informed decisions when faced with situations like domestic violence.
So you may physically be removed from the violence itself, but it doesn't mean that your memory, your brain, the way God has created our brains, it kind of...
We had a lot of fun.
Yeah.
And then, of course, we made new friends. So we are happy.
We're so appreciative of our visitors. Going forward, I'm going to put this into practice. It's more like changing my perspective completely. I just hope to see more and more of you and the partnership going on and on. Thank you so much.